Hello, and you're welcome today to your COVID-19 Staying Safe in the Workplace training. This training has been designed to enhance your knowledge and understanding of COVID-19 and the risks and compliances necessary in the workplace to ensure your safety and that of your colleagues. During the training today, we'll look at what is COVID-19, relevant health and safety legislation, the COVID-19 compliance officer, responsible person, or lead worker representative, some workplace requirements, and concluding this presentation, we have 5 short videos outlining, the first one outlining disease transmission, which gives very interesting pictorial reference to how the disease can be spread in a communal environment and in a food environment. There is then short videos on hand sanitizing technique, hand washing technique, donning and doffing medical masks, and donning and doffing cloth masks. Underpinning all of the information you receive here today is the important message that social distancing saves lives. This message will be reinforced by the information you will receive during the training programme. We've seen a number of changes due to this pandemic, including in our work environment, our ability to work itself, social interaction with family and loved ones, and we're now trying to take the steps to return to a new type of normal. And this is a normal we can expect to be in place for the coming months and perhaps years. Health and safety has always been important in our workplaces, but never more important than it is now. And it's worth noting with that normal health and safety rules and regulations that pre-existed COVID-19 are all still in place. To extend that further, we would say that as well as health and safety regulations, HR regulations, GDPR regulations, all still apply. As you progress over the coming days, weeks and months, questions and queries may arise in your workplace. It's important to raise these with your COVID-19 compliance officer or your lead worker representative, or indeed the principal within your workplace. These are your COVID responsible persons within your workplace, and this is where your queries should be brought to. Together we are stronger, and it's working together that we will get through this. We're going to look briefly at what is a pandemic, also known as a global health emergency or a crisis. And the 6 points on the screen are definitions of a pandemic. So it threatens the organisation's existence, transcends any plans, has no response structure in place, multiple parallel crises with no end position, and all crisis plans that will be in place fail. We'll now look at what COVID-19 is. COVID-19, also known as SARS-CoV-2 or coronavirus, is a novel, meaning new coronavirus that normally circulates amongst animals. Coronaviruses are a common virus amongst animals. This coronavirus was first diagnosed in the Wuhan district of China in December 2019. This virus is known as a switchover or a zoonosis in technical terms virus, and that means that it has transferred over from animal to human. So it has mutated. Symptoms of the virus include, but aren't limited to, fever, cough, shortness of breath, muscle pains, and tiredness. The transmission is via respiratory droplet, and we'll look at that a little bit further in a moment. Incubation period for coronavirus or COVID-19 is anything from 2 to 14 days, which is where we get our isolation periods from. The highest instance of onset of symptoms is between the days 5 to 10. However, there is still notable instance of cases presenting at days 12 to 14. The principal signs and symptoms include a temperature over 38 degrees, sore throat, and a cough of any kind. Additionally, the final 2 points here have been added in recent times as we're getting more data, to show fatigue, muscle aches and pains are a significant symptom at onset, and an altered sense of hearing, taste and smell has been noted as possible symptoms as we've come into the summer months. COVID-19 and how it's spread. COVID-19 is spread through droplet of fluid when a person coughs or exhales. Pre-existing COVID-19, we know from the normal winter flu and from SARS that our droplet spread distance is in excess of 1 metre. So in the normal winter flu, if we are in contact with someone that has the winter flu and we're within 1 metre distance, we are highly likely to contact the flu from them, from droplet transfer. So the 2 metre distancing arises from the physics that we know of droplet distance spread. And that's why the HSPC and the NEFIT are reluctant to reduce the safe distancing measures from 2 metres to 1 metre. So our droplet distance routinely can travel up to 1 metre. Therefore, if our distancing is reduced to 1 metre, then we are possibly within an unsafe zone. Asymptomatic carriers are a known spread of COVID-19. Asymptomatic carriers are people who are shedding the COVID-19 virus but are unaware they have contacted the virus. So they don't actually feel any symptoms. They don't have an obvious cough, temperature, sore throat, aches or pains, or any of the known symptoms. Yet they have contacted the virus and have the ability to pass it on to somebody else. Pre-symptomatic carriers are people who are unaware they have contacted the virus before or at the early onset of symptoms when they're so mild that they're unaware of them, and are shedding the virus and spreading it to other people. The droplet lands on anything that's in the vicinity of a person. So this can include tables, desks, phones, cutlery, tableware, pens, magazines, documentation. So anything that's in the immediate environment of a person when they are speaking, exhaling, coughing, sneezing, will have droplet land on it. And that is how the virus is spread. To stop the spread of the virus, the underpinning measures are the ones you're familiar with. You've seen these signs on every public place you enter and across our media for the last number of months. Washing our hands to prevent contamination or avoid contamination. Covering our mouth and nose with a tissue or sleeve when coughing or sneezing, and discarding of the tissue immediately after use into a bin. Avoiding touching our eyes, nose or mouth with unwashed hands. Cleaning and disinfecting frequently touched objects and surfaces. Stopping shaking of hands or hugging when saying hello or greeting other people. And maintaining a safe distance of at least 2 metres or 6 feet away from other people, especially those who might be unwell. This poster before you outlines the common symptoms and where they overlap with flus and head colds. So we'll see that fever, temperature, cough, shortness of breath, fatigue, aches and pains are all common symptoms of coronavirus. However, many of those are also common symptoms of the regular flu, and some of them are common symptoms of a cold. So there is huge overlap between the symptoms of the three, and at this time of the year it's worth mentioning that there is also significant overlap with hay fever and sinus and allergy symptoms. Isolation requirements. Isolation is required in the event you have a contact with a known or suspect case of COVID-19. Additionally, if a member of your household has had contact with a known or suspect case of COVID-19, you are required to isolate, and requirements are for your entire household. Isolation is required for 14 days, and anyone who needs to isolate should see the self-isolation at home document advised by the HSPC and available on the COVID tracker app. If a person shows symptoms of COVID-19, then isolation for a further 14 days is required, and at least 5 days after the last day of temperature. A person must be showing no symptoms and have followed the advice of their GP. Any concerns you have regarding exposure and reporting isolation needs should be reported to your lead worker representative immediately. Again, the principles of prevention of COVID-19 are washing your hands, covering your mouth if you're coughing or sneezing, avoiding touching your face, keeping surfaces clean, and keeping a safe distance. We all play our part in stopping the spread of COVID-19. It's important we keep up to date with how spread is active in our community and within the country in general. And we would ask that you ensure that your resources are reliable, check them daily or weekly, check on the Department of Health updates, and keep an eye to local reporting. An example of reliable data is this a screenshot taken from the COVID-19 updates, which still shows that the majority of our transmission is from close contact with a confirmed case at 65.9%. So almost 66% of cases is still close contact with a confirmed case. So this again comes back to the social distancing and the importance of maintaining that once we return to work. This information has all been downloaded from the COVID-19 Ireland GeoHive website. This is updated periodically, and it'll also always be dated and timed with the most recent update. This screenshot here shows you the breakdown of the number of cases per age profile. As we can see, we have low incidence in under 14, and this may be contributed to the fact that they've all been isolating at home, but we are seeing low transference amongst households to children. And we have low enough instance in our older population here as well, who are isolating and cocooning at home, or who have. The highest instance is still reported from the 25 to 55 age group. Again, these are our people that are out working, and so the measures we put in place has never been more important than going forward now as we all start returning to the workplace. This site is extremely useful for maintaining knowledge and information. It's worth looking around and through it. The COVID-19 Ireland GeoHive Hub for reliable, up-to-date information, county by county, admissions to hospital, discharges, deaths, numbers recorded per day. All of it is available and up to date on this site, including a breakdown per county and per Townsland area. Relevant bodies for up-to-date and reliable information include the Health and Safety Authority, the HSE, the NSAI, the National Standards Authority of Ireland, NEFIT, the National Public Health Emergency Team, the World Health Organization, the ECDC, which is the European Centre for Disease Control, and the HSPC, which is part of the HSE. Health and safety legislation. We'll take a look now at the health and safety legislation that applies in Ireland. Our main health and safety legislation is the Safety, Health and Welfare Work Act 2005, and this underpins and manages all of the health and safety regulations in Ireland at the moment in workplaces. The 2007 General Applications Regulations applies all the practical tools to applying the Act within the workplace. Since COVID-19, we've had 11 statutory instruments and amendment regulations to date, numerous National Standards Authority of Ireland guidance documents and checklists, and Health and Safety Authority guidance documents and checklists. And all of these are available on their websites. Under the Safety, Health and Welfare Work Act, the employer has significant duties. The main one being to provide a safe place of work, safe access and egress, and safe means of work. Being familiar with the safety statement, identifying and providing safety training needs, ensuring necessary inspections are carried out, ensuring safety standards laid down are adhered to, and monitoring the activities of others to ensure safety for all persons in the workplace. So all of these are extremely relevant with regard to to COVID-19 and the measures that are being put in place at the moment. Employees also have duties under the Safety, Health, Welfare at Work Act. These include care of his or her own safety, cooperating with the employer and enabling him or her comply with statutory obligations, reporting any defects to the employer of any plant, equipment, safety measures, equipment, anything like that. And finally, use of equipment provided, clothing, aids, etc. The principles of prevention underpin the safety measures that we apply in Ireland. And we'll look at them briefly here now. The principles of prevention include the avoidance of risk where possible, evaluation of any unavoidable risks, combating of the risk at source, which is impossible in this case because it's a pandemic, adapting the work to the individual. So we're adapting the work at the moment to ensure it is safe for the individual. Adapting your workplace in line with technical progress, which is the measures you've seen happening. Replacing dangerous systems with safer alternatives. Developing a prevention policy, which would include your COVID-19 return to work policy. And giving priority to collective protection measures. Collective protection measures include measures that apply to everybody in the workplace as opposed to individual protection measures, which would be gloves, face masks and measures of that nature. So where possible, we will try to collectively protect people, and one of the collective protection measures is social distancing. The COVID-19 compliance officer, responsible person in your workplaces are your line managers or your principals. The COVID-19 compliance officer or the designated person for COVID-19 operating procedures and prevention plans in your workplace and designated work area. The duties of the COVID-19 compliance officer include marshalling staff entering or exiting the workplace at start of the shift or the day where necessary, conducting sign-in and temperature checks, assisting with creating walking routes, rotas in relevant work areas, implementing policy regarding canteen rotas, use of toilets and changing facilities. Review the need for meetings and arrange suitable alternatives, ensuring social distancing is maintained. Ensuring signage, information posters and floor markings are in place. Ensuring PPE and sanitation is readily available and supplies are maintained. We're currently recommending that all workplaces maintain a 30-day supply of all necessary PPE. The communication of information and training needs with regard to new measures put in place, coordinating and monitoring of all cleaning rotas, maintaining compliance checklists, return to work forms, visitor questionnaires, temperature logs and contact logs. We'll look now at dealing with a suspect case of COVID-19 in the workplace. So any worker who feels they are unwell should not attend work until they can clarify symptoms and seek medical advice from their GP. However, should an employee become unwell in the workplace, they should remove themselves from the work area to a predetermined area identified in your COVID business response plan and put on a face mask. They should then inform their COVID-19 compliance officer or lead worker representative or principal in your area. The employee will remove themselves from the work area without delay and avoid contact with all employees. The designated area for isolating in your workplace will be identified in your COVID response plan. Social distancing must be maintained from any member of staff who becomes unwell with suspected COVID-19 in the workplace. If the employee is well enough and has suitable travel means, then they may go directly home and self-isolate at home as advised in the Isolating at Home guidelines. They should contact their GP as soon as they get home and advise them of their symptoms. If the employee cannot go directly home, they must remain isolated in the room assigned and avoid touching people, surfaces or objects. Public transport cannot be used as a means of transport. Any instance of COVID-19 in the workplace should be documented on your incident report form and record all follow-up actions necessary and cleaning requirements. Maintain to hand the contact log for an employee that has become unwell for liaison with the HSE. If an ambulance is necessary to transfer them to a medical facility, then inform the ambulance service when you contact them. A room that has been used to isolate a suspect case should be ventilated for 2 hours prior to cleaning. Cleaners must wear all necessary PPE and a terminal clean must be adopted. The COVID-19 lead worker representative will be involved in day or shift briefings, briefing and communications as any precautions are reviewed or changed, and this is to be expected when we're in crisis management, and as any risks necessitate. They will also be involved in managing all staff declarations, which include your return to work form, which will be completed on your first return to work, after any absence or leave, or after any holidays will be subsequently completed again. Incident report forms must be maintained by them, and any contact tracing will be maintained by your lead worker representative. Any visitors to your workplace should also have a visitor questionnaire completed, and these will be retained by your lead worker representative. The lead worker representative will monitor and assess and audit all checklists and records. These include cleaning records, tea, lunch break or canteen rotas, use of toilets, locker rooms and changing facilities. We'll look now at some specific workplace requirements. The first thing you will notice as you return to work is the amount of signage. Signage will outline areas including social distancing and the need for hand washing and cleaning measures. So it's important that you pay strict attention to the signs as you come across them until you're familiar with them, and not to become complacent over the subsequent week or two, that you refresh and reread the signage, because they can be changed and updated as measures are altered or amended. Most of the signage in our workplaces will be similar to what's on the screen before you. So the yellow background or amber background with black writing. This is because this type of signage is what we're subconsciously familiar with regard to caution, warning, danger, and so this is the colouring that's used, because these are warning signs. These are, caution signs. With regard to access and egress, we can expect to find one-way routes and walkways designated within the workplace. Lifts being restricted to one person at a time. Lifts being restricted to upward use only, or reserved solely for those who physically need to utilise the lift. Separate entry and exit where possible, or where the main entrance is sufficiently large enough. We may see a setback stop-go system where personnel will give way to two-way traffic as necessary, and particularly this will also be applied where we have narrower corridor or pinch points in traffic. So a step back stop-go system where one flow of traffic will give way to the oncoming traffic. Sign-ins. We would recommend that you all use your own pens for sign-in, or where possible have personnel actually checking in people, so that there's only one person handling the sign-in documentation. canteens, open workspaces, and shared workspaces. In a canteen environment at the moment, a table that normally seated 4 people comfortably now should have 3 of those chairs removed from use. So a table should now seat just 1 person alone. Depending on the size of your canteen, it may only be suitable for 1 person to have lunch at a time. This is where we have seen workplaces allowing 10-minute time slots for staff members to prepare their lunch for eating. And in some instances, staff are dining at their desks. If you dine in your canteen, the table that you're dining at should be clear of all debris such as newspaper articles, flyers, business cards, condiments, anything of that nature. The table and the environment around it should be kept completely clear so that it can be cleaned before and after use. To explain this a little bit further, you should, after you've finished dining and you remove your food items, you clean down the surface of the table with cleaning detergent and wash it down. The same goes for the chair. Once you're finished using it, that you clean down the back and the arms and the surfaces of your chair. This leaves it clean and ready for the next person to use. To differentiate between cleaning and decontaminating or disinfecting, cleaning would be the use of warm soapy water or other cleaning surface sprays. To disinfect it or decontaminate it, you can follow through with alcohol-based disinfecting or cleaning down. In open workspaces and open work areas, 2-meter social distancing or safe social distancing should be ensured in all work areas. Where this isn't possible, there should be dividers or perspex screens between work areas sufficient to cordon them off. We're now seeing a lot of shared workspaces where desks have had to be removed from work areas and people are now working part of the time or most of the time from home. So their necessity for a full-time work desk has been reduced. In this instance, the desk that is being shared should have the minimum items on the desk as required for the workers. Therefore, a desk, chair, telephone, light if necessary, hand sanitizer gel and surface decontamination or disinfecting wipes should be on the desk. Between each use and before and after use, your area should be cleaned. So when you arrive at your desk, you use the hand gel and then the surface disinfecting wipes to thoroughly disinfect all the surfaces, including the handpiece of the phone, the keyboard of the phone, keyboard of any computer or docking station, all of the surface of the desk, the arms and pedals of the chairs. So all of the surfaces you're likely to have contact with. When you're finished using your workstation, the same procedure occurs. So you thoroughly clean it down for the next person. To differentiate between cleaning and disinfecting, the cleaning, we recommend cleaning detergent and cloth, and this will be where there will be visible marks, stains or dirt on a surface or an area. Disinfecting or decontaminating usually occurs with disinfectant wipes or alcohol-based wipes or surface cleaning wipes that have been identified suitable for COVID-19.
Canteens, toilets and changing rooms. We'd recommend that you apply a clean in, clean out policy in your canteens and toilets. To explain this a little bit further, this would mean that you would provide cleansing wipes and sprays outside or inside either of these locations where a person will clean down their contact points. So you take a kitchen area, so the seat and the table area that you've sat at will be cleaned and then decontaminated after use. If you've used the kettle, the handle to the cutlery drawer, the fridge, the microwave, all of these areas will be cleaned and decontaminated. And depending on the size of the spaces in your canteen and toilets, it may be necessary to restrict the use to single occupancy at a time. Staff who have public-facing roles or close contact with members of the public will see measures such as perspex, hand sanitizer stations, markings on the flooring for at least 1 metre distancing, additional provision of face masks or face shields, and the implementation of a cleaning regime in their work area. Display of any COVID-19 measures will also be Staff who are public-facing or close contact roles will see measures such as perspex, hand sanitizer, and floor markings outlining a 1 metre safe distancing around their work area. They'll also be provided with face masks or face shields as necessary. There'll be a strict implementation of a cleaning regime in their work environment, and COVID-19 measures will be outlined on posters in their work area. Hand sanitizer and hand washing. Hand sanitizer stations and the location of them have been reviewed within the workplace, and additional ones have been placed where necessary. Hand washing facilities are routinely available, and we would encourage the regular use of both hand sanitizer and hand washing facilities. Hand sanitizer doesn't replace the need for hand washing before or after eating or before or after use of toilet facilities. And the hand sanitizer is a backup measure where we can't reach hand washing facilities routinely. First aid in the workplace. The following PPE will be available for any workplace first aiders, and they include disposable nitrile gloves, FFP2 or 3 face masks, disposable plastic aprons, and enclosed eye protection. All of these should be used where a first aider is required to treat a person in the workplace and they can't maintain social distancing. So in addition to any standard infection control precautions that will be used by a first aider, the following measures. The first aider should wear FFP3 masks treating all patients. All patients receiving treatment for minor injuries that excludes respiratory distress or oral cavity or facial area injuries that fall under a face mask area should also wear a face mask during the treatment. In the event of a suspected cardiac arrest, do not check for breathing and apply compression-only CPR. So a compression-only CPR is the only CPR recommended at the moment. This can be done in addition to using your local AED. Where possible with minor injuries, the first aider should advise the person from a safe distance on the measures to take to care for their own injury. All equipment included in the first aid box should be disinfected after each use. Legionella. Legionella is an organism that's naturally present in water, but when it's allowed to grow and multiply, it becomes a health risk. Growth of Legionella occurs when water lies stagnant and reaches temperatures over 20 degrees. The management of Legionella and a risk assessment should be taken in each workplace to ascertain areas that may be high risk and the controls that need to be put in place to eliminate the dangers of Legionella. Cigarette smoking has been identified as a risk of increased transmission for a number of reasons. Firstly being that cigarette smokers don't normally or routinely maintain a 2 metre safe distancing. And finally, because of the repetitive nature of the hand to mouth, cigarette smoking will always be a high risk of transmission. We recommend minimal clothing and keeping personal items that you bring to work to a minimum. Any PPE that's used for work should be stored or retained in work or in a suitable box in your vehicle. And it's currently advised that clean clothes should be worn daily. The poster on your right hand side is information that was provided to employees of the HSE on how to minimise bringing COVID-19 home. The measures included not bringing wallets or handbags to work, placing cards or cash and driver's licence in a Ziploc bag, as Ziploc bags can be easily decontaminated, leaving your pen at work and cleaning it as often as possible with hand sanitizer, wearing minimalist clothing and aim to leave as many items you use at work outside of your home. Avoid eating in communal spaces and only drink bottled water. Don't use reusable coffee cups where possible. Bring your own food in a reusable, washable shopping bag. No case on your phone, and wipe it down often with hand sanitizer. A Ziploc bag has been recommended for storing a phone in as well, as they're easily decontaminated. And where possible, use no hands, use elbows or knees to push doors and sanitize your hands regularly. At the end of the day, wash your hands, arms and face. Use sanitizer to wipe down the phone and leave as many items as possible at work. When you get home, shoes off outside, clothes off, shower immediately, wash your clothes in reusable bags at 60 degrees. We have a picture of a fingerprint, and the message is that everywhere we touch, we leave our fingerprint. Everywhere we touch, we have the potential to pick up or leave COVID-19. We need to prevent the transmission through strict hand washing and hand sanitizing, good cough etiquette, avoiding touching our face and eyes and mouth with our hands, strict and regular cleaning, avoiding handshaking, and maintaining social distancing. We need to work together to stay apart. We hope you found today's training beneficial, and the best of luck with returning to work.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19. Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.